All right. Yeah, welcome everyone. Quick introduction. Some of you are here through an invitation from Melissa or through our mailing list, a sort of segmented version of our mailing list. But for those that don't know me, I want to say a little bit about myself, not a whole lot, and about the organization. My name is Hunt Priest, and I am a priest, which is a little confusing and annoying, but I'm a priest of the Episcopal Church, and I live in Savannah, Georgia. I'm a native Kentuckian, but I lived in Georgia most of my adult life. I did live for 8 years on Mercer Island. I was the rector or senior pastor of the Episcopal Church. There's a couple people from there. Stacy's one, and Kate's one. Beverly worked with me there, and for 8 years. And it was there, actually near the end of my time there, that I saw an ad for a study of religious professionals at a research project on the East Coast. I applied for it. It was religious professionals and psilocybin. And needless to say, it changed the course of my life and expanded my ministry in ways that I could never have imagined back then. And part of that expansion is this organization, Ligare, which is a network of not just Christians, but primarily Christians and other spiritual people and religious people at the intersection of spirituality and religion and psychedelics, primarily around healing and spiritual formation, understanding that the psychology and the mental health part is hugely important and certainly part of the ministry of the church. But this is less clinical. This is a less clinical discussion, although we have a clinician here who also in his own life balances the spiritual and the clinical, carving out space for conversations among religious people about how to integrate psychedelics into their own spiritual life for healing and for wellness and for spiritual growth and development. So if you're not on our mailing list, please consider joining it, ligare.org, and you can sign up for it there. And ligare is a Latin word. It means to bind or unite. It's the root word of the word religion. Religare is actually where religion comes from, to rebind. So and the way I'm imagining this, we're rebinding ourselves to each other and to God, and spiritual practice, mystical experience, whether it's through psychedelics or not, is part of that. So psychedelics is just part of how we imagine these being integrated into spiritual growth. So I'm going to introduce, so that's a little bit about Ligare and about me. I'm going to take us just a minute to make the transition from the busyness of our lives to this sort of sacred time that we're going to have with Dr. Tony Bach and all of you. So I'm going to take just a few seconds of silence, and I'm going to offer a prayer from my own tradition, a prayer for doctors and nurses. So, because I think we have some medical people on here, and that's Tony's work as well. So take just a minute, kind of make the transition from the busyness of the day to the evening time. And I'll hold that for about 15 seconds, and I'll offer a prayer. O God, sanctify those whom you have called to the study and practice of the arts of healing and to the prevention of disease and pain. Strengthen them by your life-giving spirit, that by their ministries, the health of the community may be promoted and your creation glorified. All this we pray through all your holy names. Amen. I'm going to turn the screen over to Alyssa Jomay, who lives actually on Whidbey Island. She's been an intern with us through her academic work at Naropa in Boulder, and has been working on a couple projects with us. And she's going to pretty soon join us as a staff person, as a kind of a coordinator for the Western U.S. So I'm excited about that. But Alyssa, I'm going to turn it over to you to introduce our special guest tonight.
Thank you so much, Hunt. All right. We are so excited and so honored to have Dr. Tony Bach here with us tonight. Tony Bach is the professor of medicine at UW, University of Washington. He is the founding co-director of Cambia Palliative Care Center of Excellence. His dedicated research in communication between patients and clinicians has helped found Vital Talk, which is a training program for nurses and clinicians in communication skills for end of life and difficult transitions, serious illness. He is the principal investigator for the first randomized trial study for psilocybin-assisted therapy for nurses and doctors who experienced the difficult and traumatic effects, experiencing depression and burnout from the frontline work they did with the pandemic, COVID pandemic. He has also facilitated psilocybin retreats with Synthesis Institute in the Netherlands. And he is a longtime Zen practitioner and who has received his lay vows with Roshi Joan Halifax. Dr. Bach, thank you so much for being here tonight. We are also excited to get to have conversations with you.
Alyssa and Hunt, thank you so much for this invitation. Can you guys hear me okay? Is the sound coming through?
Sure.
Okay. And I see a couple of old friends here, so I'm excited about. So hello. I was wondering if, just by way of a quick introduction, if you would mind typing where you are in the chat so I can just see where you guys, where everyone can see where everyone is. And you can either say where you work or what institution where you're with, or just where you are sitting right this moment. Either of those is fine. So Alyssa, perfect. Coopville, Soap Lake, thank you, Yaya. Nico, Portland, great. Will, Wendy, great. Zooming in from Bend. Stacy, you're really local. You're really local. Okay, I'm actually on Vashon Island today. Beautiful. Okay. Wonderful. And I'm also wondering, what kinds of issues are you most interested in discussing with me and the rest of this interesting group today? Like, what's on your mind? And it could be something that came up while you were watching watching my video, or another video if you didn't watch my video, which is not a prerequisite at all. And so if you would type that in and you can have a minute, I will tell you a little bit about my background in psychedelics and my background in my own spirituality, just so that you have a bit of a baseline. Because it turns out I'm super interested in this issue of spiritual formation and how we all come to ourselves in that way. And so I'm excited to talk to you about all that. I was completely a psychedelic novice until about 2017, when I had been talking to Cody Swift, who is part of the River Styx Foundation, and he was actually one of the funders for the study that Hunt was in, and their foundation has funded a lot of the really seminal research in this area. I'd known him because he had been a funder in the end-of-life space, and so we had had coffee once in a while, and he told me about the psychedelic work, and I started to read about it and thought, wow, there is something going on here. And I thought, is it for real, or what is this? And I felt like I would never be able to talk about this or work on this with any credibility unless I had an experience myself. And although I went to college in the Bay Area, I'd never taken any drugs of any kind. I had not even smoked pot, actually. And so I arranged to have a guided psychedelic experience and ended up writing that paper that I sent you. But suffice it to say, I had a profound experience, and it really made me feel like, wow, I should be, this is where the next phase of my career is going to be. And so that is what I am in the process of now. And so I'm about 70% of the way through this group study. But to get there, I did the MAPS MDMA training, and I was a student in the CIIS program. And I also went to visit all the researchers who were really doing work. So I went to NYU and met Steve Ross and Tony Bossis. I went to Baltimore and met Roland and Mary Cosimano. I went to Switzerland and I met Peter Gasser and some of the research up there at the University of Basel. And it really gave me a sense for what was going on. And it really seemed to me like my own role in this evolving ecosystem. Could be as someone who kind of straddled this world between the clinical trials, and being able to mount that kind of a thing as a legal way to do this now. And this other issue of, what does this mean for us as we develop as people in all dimensions, psychological and spiritual, and what led, gave me that in mind, and the reason I don't think of this as just a medical kind of intervention is I have my own work in Zen Buddhism. So my spiritual formation is that I started to get involved in meditation about 35 years ago, really as a way of dealing with my own kind of stuff as an oncologist. As a young oncologist, I remember following around all these famous people. And, I went to Harvard, so there were a lot of people who thought they were really expert. And it was pretty clear to me that when it came to talking about mortality and dealing with our own mortality and dealing with the things that we were all facing, in fact, that there wasn't a lot of expertise there at all. And it wasn't until years later that I met Rachel Remen and Joan Halifax that I really found that there were other ways through that material. And that really both inspired my work in communication skills and eventually got me into taking my lay vows as a Buddhist practitioner. And I would say at this point that my Buddhist practice has been one of the foundations of my work as a clinician. It's kind of there in the background, although not always visible. And I think a foundation of my evolving work as a psychedelic practitioner, because I have found that one of the things that comes back to me over and over when I am sitting with people who are in a psychedelic experience is simply that ability to sit with whatever is coming up. And I have tapped right into what I know as a Buddhist practitioner. And I think that's something that all of you have and know and practice as spiritual practitioners, is that ability to just be present with people. So what I have seen in my study and with other groups and individuals that I've worked with now in psychedelic contexts, and I've mostly worked with psilocybin. I've had experiences with MDMA and with LSD and with psilocybin, but my work as a guide has really been with psilocybin. What I have seen is that it really enables people to step back from the roles that they have constructed for themselves in the world, the way they habitually see the world, and the way they present themselves, to me as a clinician and to themselves even. And by stepping back from that, it really enables them to experience themselves in a new way. And that is what has happened to me. I mean, in my psychedelic journeys, have come to experience myself in a new way that has really allowed me to shake off, shake away the decades of conditioning I have as a doctor, somebody who went to college, somebody who grew up in this particular culture, and all that. And so that has been a huge opening for me, and I think is really setting the stage for the work that I am doing now. So I'm going to stop there, but feel free to ask me more details about that. I mean, I have had a long relationship now with Joan Halifax, who's been my Zen teacher, who I have worked with and studied with now sat with for 30 years. And I just came back from the session that I've gone to yearly now for about 20 years, where we sit for 8 days. And it is a beautiful, beautiful ceremony. We hadn't been together in person for the past 3 years because of COVID, and getting back to it just felt like a relief to sit with people together in that way. So really beautiful. So please feel free to ask me more about that. I'm not going to go into more at this point because I see that you have loads of great questions here. And so I am maybe going to just start with a couple of these questions. And I will say that anytime you want to ask more or ask me to go in a different direction, I'm just going to ask you to raise your hand and I'll just call on you and we can just go from there, right? But I'm interested in having a conversation with you all, so don't feel like you just need to listen to me, because honestly, I certainly do not have all the answers in this area. So Hunt and Alyssa, how does that sound to you? I've kind of talked a little longer than I
That
expected.
sounds good. No, that was great. I think, yeah, I do think a conversation would be valuable. I'm noticing, because there's a combination of medical people on here and spiritual and religious professionals. I know there's at least one other palliative care doc on here that I know, somebody I know, Bush Island, and then some clergy. So one of the questions that's coming up a couple of times was where you see the role of chaplains, where you've worked with chaplains in the past as an oncologist in palliative care
Yes.
in the hospital setting, and where do you see that particular role fitting into
Yeah, it's a great question. Also, I've worked with chaplains on all my palliative care teams, right? We've always had a chaplain, and I have come to see chaplains on these kinds of teams as really important partners. And just honestly, it reminds me constantly that the biomedical lens is not the only way to see existence and not the only way to see problems. And, I kind of get pushed into it when I'm at work, on the wards, seeing patients in the hospital, because everything gets talked about in such a biomedical lens. And I feel like one of the things that the chaplains are always gently doing, always in a loving way, is reminding me that actually there is more out there. And I'm kind of like, oh yeah, there's this whole spiritual life. And of course, I've worked with chaplains and seen them invite people into a conversation and seen patients respond to them in ways that they would never respond to me, because they don't feel all that professional stuff. They don't feel like they have to perform in a certain way. I think there's really a lot of pressure for patients to be good patients for the doctor. And so I've really appreciated that. And so what I am hoping for in the future of psychedelic therapy is that people with spiritual training and chaplains, I'm not sure exactly what the right category will be, but that people with real spiritual training will be part of these teams that see people, that counsel people, that work with people before and afterwards, that help people decide if they should really have a psychedelic experience, right? Because I do think that what spiritual training gives you is a different set of perspectives and practices with which to approach these huge questions that people are struggling with. They're questions about, how am I going to live? What's it like to face all this death? What's going on with me? And I have over the years become a little bit suspicious of the value of the medical lens in talking about our experience, right? Like the way that we as doctors talk about depression, and then the language that we've introduced into the world, it's useful in a certain way, but it's also very constricting for people in a certain way. And I think one of the important things that psychedelics can do as they open people up is they allow people to experience themselves in new ways, to experience their old stories in new ways, and to create new narratives for themselves about them. And so I feel like having a group of people with different ways to listen to those stories and different ways to respond, I think is really important to make the most of these things. So for example, I will be personally unsatisfied if psychedelics turn into something that's just for, another tool for depression. Like, I think that's just a very reductive way of looking at that. Now, as a doctor, I can say that right now I am pursuing that, honestly, because I think that the medical uses and FDA approval is a huge leverage point for reintroducing psychedelics into this culture. And it's a leverage point because there is a very specific technology that allows us to measure how safe psychedelics are. And I think for the public right now and for legislators right now, that's super important. And to do that, we have to play by all the medical rules and do the medical diagnoses and all that sort of stuff. But I do think that there is a whole other dimension of the real use of psychedelics that is not necessarily for people with mental health diagnoses, but for people who are experiencing everyday life and they want to have a deeper emotional life, a deeper spiritual life. And I'm hoping that we as a society can get to a place where those experiences are available to people without pathologizing them, right? You don't have to pathologize yourself to find a way into a psychedelic experience. And once they get to those psychedelic experiences, I'm hoping that people have guidance from people who really can help them through a whole variety of experiences. Right. So that was a long answer to your question,
No,
Hunt, but
thank you,
does
Tony.
that, yeah.
Yeah, that's great. I'm going to ask you one more question. I'll let Alyssa go through the chat too. But one question that I see is around spirituality and around, and a really pointed question from my friend Beverly Hosea, not pointed, but specific about, she's a meditation teacher as well.
Yes.
And so the
Yes.
question is, kind of how has psychedelics interface with your own meditation practice?
Yeah.
How has it helped, or because I think that'd be
Yes. Well, so what I can say personally is my experience in meditation practice. So for example, when I've been in long retreats, and I have this in long retreats more than in short retreats, I will have these non-dual experiences where I kind of drop into something else. And sometimes it's really short and sometimes it's a little bit longer. And I have to admit, as the level of practitioner I am, it's not a deep, sustained place for a while. Like when I'm in an 8-day retreat, I am definitely kind of in a different place. By the time I get out of there, I don't even realize it. But psychedelics for me have opened up this place of a deeper, sustained place of kind of ego dissolution, for lack of a better word. And by ego dissolution, I mean that the trappings of my usual self, the things I know of me, have kind of dropped away, and I am seeing my life and experiencing myself in different ways. And to give a really specific example about this, it's really changed how I experience myself through my body. One of the things I have gotten from my different psychedelic experiences is a sense that my body is in fact the conduit through which I am accessing and am connected to the rest of the world, the rest of the universe, to God, if you use that language. And I have had these experiences where I am able to really feel that in a vivid way. And that feeling actually translates into the rest of my life. Not at the same intensity, but I can tap into it from time to time. So it's given me a new point of reference for the kind of state I am trying to access when I am meditating. So when I'm meditating, I am trying to access, or at least give a place for that other part of myself that is not driven by agendas and, science and my to-do list and all that. Like, is there a little piece of like the eternal, for example, or I don't know, the sacred that I can actually remind myself about? Because I am actually part of that. So I would say for me, my psychedelic experiences have really added a new dimension to my sitting practice. And they have actually changed my sitting practice. And so I think that is not unusual. And I think the other thing that I can say is from my experience with doctors and nurses, most of whom have tried meditation a little bit because they heard it was good or, whatever. I would say that it's really jump-started a bunch of them into some kind of meditation practice. And actually the meditation practices also helped them hold on to the benefits of the psychedelic journey. And so I really think there's something quite complementary and synergistic about the two kinds of practices. I've heard, what's his name? Bill Richards talk about how they often think at Hopkins that they're giving people a crash course in mindfulness. And I think that's quite right. And what I also see is that people in my study who have zero contemplative background of any kind and don't have a lot of capacity to drop into that space, they don't drop into the same kind of place in a psychedelic because they are still thinking about things and analyzing things and observing themselves. And actually, it turns out that you can completely distract yourself out of your psychedelic experience. And I have actually seen that happen in a couple of different places. So, Stacy asked for someone who's meditates regularly, do you think you could reach the level of awareness that you have now without the use of psychedelics? I don't know. That's a really interesting question. I don't know if I'm going someplace different or I'm going to the same place or what. I don't think I have enough background to really know. And maybe that's the $1 million question, right? Like, I don't know. I mean, one of the things I can say is that I do have the sense that there are people in the psychedelic world who just use psychedelics to hit that state all the time because they don't have an outside practice. And so they are actually using psychedelics to remind themselves. Whereas I can actually remind myself with my daily practice. And I think there is this kind of thing that people can get into, which I've also seen, where people are using psychedelics just to do that. And in fact, what they really need is they need a daily practice, right? And so I don't know if that's exactly answering your question, but that's my sense. Do you want to ask, Stacy? I don't know if I'm
what jumps
getting at
to
your
mind
question.
is when I've talked to friends about my excitement about using psychedelics is primarily for depression and addiction. But that's like, I agree that that's really limiting, and that
it's one use.
Yeah. So what I get is a response like, well, why don't you just, go to therapy or,
Yes.
when I describe what I think might come out of a psychedelic experience, they, and all the integration that you have to do afterwards, they say, well, why don't you just do that? Act as if, you've had that experience. And
well, so what I can say there is, you can spend a long time in therapy trying to lower your ego defenses to the degree that you can actually do the therapy, right? Whereas a psychedelic experience can help you do that in a session. And I think that is what's really happening in those MDMA sessions for people with PTSD. So there is something that happens that often would take years and years and years of therapy. Now, I think that's what happens in therapy is a little different than what happens in a meditation practice or a contemplative practice. But did I get at your question there? There is a qualitative difference to what happens in a really well-guided psychedelic experience and regular psychotherapy.
I have a suspicion that some of the pushback response I get is from the stigma, the fact that psychedelics is a drug that has been kind of demonized.
Sure. And of course, I think that's totally out there. And I think that's going to be a long cultural change, right? I think, we're talking right now to the early adopters. If you're on this call, you're an early adopter, right? And that's a whole different kind of adoption issue. Barrett, am I pronouncing your Barrett? Do you want to ask?
Yeah, it's Barrett. Thank you.
Barrett. Sorry. Thank you.
No worries. So I'm actually a counseling student at Seattle U, and I've been following the healthcare working psilocybin research out of UW throughout this process, studying alternative healing. And so I am really excited to talk to you. I have not a fully articulated thought, but I just kind of wanted to pick your brain a little bit. We have, in my opinion, we have these really systemic issues in the healthcare world of these overworked nurses, overworked doctors, and the root of the problem sometimes seems to be like the system and overworking our healthcare professionals. And so like as a counseling student and someone also in alternative healing, I have like, okay, how can we help the individual person? And
Yes.
maybe that's some of these like meditative practices and, you know, alternative healing methods. But then also we have another issue of like, how do we need to change our like bigger system so that we don't have
Yes.
so many burnt out healthcare workers, and like where's the research on how to do like that, you know, like that kind of stuff, and where do we like
Yes.
intersect in that like
Yes,
complication?
yes.
I don't know if
Well,
that makes sense, but
no, it makes a lot of sense. So I think you're really pointing out there's been a great deal of attention to the system configuration of healthcare right now and how that is creating burnout, right? And creating a kind of disillusionment, I would say, for many clinicians. And I think that is a huge issue and needs to get addressed, and is going to be a very complicated political issue to address because it involves a lot of money, right? The other part of that, though, and this is the part that I see in my study, is that the clinicians themselves are going to need to get themselves into a place where they are able to ask for what they deserve. And what I see over and over and over, especially in the nurses, because nurses are more socialized like this than doctors, is they don't want to ask what they really need. They don't want to ask for what they really need, and they're not. And what you are seeing now in the horrible working conditions for nurses now is that this has gone on for years and years and years, and the professions have not figured out how to make a case to politicians, regulators, and insurance companies that, in fact, this is an unsustainable situation. So what's going to happen is, what I see happening now is we are headed into a crisis, and it's going to be a crisis about nursing, but it's also going to be a crisis about healthcare. You know, you may have seen in the New York Times just today or yesterday, there was a little brief documentary about why there are no pediatric ICUs to take your kid who is a horrible respiratory virus, because it's not profitable enough, right? And you kind of go, this is insane. How can we be saying to parents and kids, we don't have care for you because it's not profitable enough? I mean, it really speaks to a deep place in how healthcare is constructed. And so I think one of the things that psychedelics do is equip people who are those clinicians to, in fact, speak up and actually make a case and talk more explicitly about how the situation needs to change and how, in fact, they're going to leave if it doesn't change, and not just sit there and be taken advantage of and be abused in different ways. Because, you know, it's for many of them, it is not a sustainable situation. And in fact, the solution for them is at a personal level, they will need to leave. You know, the anecdotal research in burnout, and there's not a lot of research about people with severe burnout, is basically people end up leaving their position because they need to reset themselves. They need to get out of that environment totally. And when they leave and come back, they often come back to something quite different. So, yeah. I'm going to move on, Barrett, but we may get back to this because it's a huge issue. Yeah. Am I pronouncing? I'm going to mispronounce everybody's name.
That's right. Yes, thank you. Thanks for being here, Dr. Tony.
You are welcome. Please call me Tony. You don't have to call me Doctor.
Tony, okay. My questions are around access for end of life, palliative care, death anxiety. Can you talk about if there is anything happening here in Washington? Do our patients have access to those kind of things? And just what's happening in that world?
Yeah, well, what's happening in that world, what I can say is, in the big front, there's a large multi-site trial, like 3 or 4 sites, of psilocybin for demoralization for people with life-limiting illness, and that actually has not started to enroll patients yet. There's another study at 2 sites at NYU and Denver that is going to be cancer patients with again, 2 therapists and 1 patient, and that is now also just in the preparation phase and about to be launched. I think in the short term, I think the access is actually going to be in Oregon when Oregon opens up, and I think the trick there will be to find a center and therapists in Oregon who really know this territory of end of life and existential anxiety. So I think that's the short-term access. It turns out that I have a study that's been funded that I can't really announce officially, that is going to be a new study for a group intervention of psilocybin-assisted therapy for people with cancer, people with metastatic cancer. And so that I can't announce it yet, but officially, because the contract hasn't been signed by the university with the funding agency. But that will be a study that is looking at psilocybin-assisted therapy in a group setting. I'm working with another investigator who has a lot of experience in all the group interventions that have been done for cancer patients. And so we're kind of combining the science on group interventions for psychosocial issues and psilocybin. And so that will be enrolling, and we are going to do that we are going to try to do that at retreat centers. And so there are a couple of different retreat centers that I am working with now. And I can't say for sure because I haven't gotten approval from the FDA and the DEA yet, but it looks possible. So that's what I'm working on, is so that because I think the group experience could even be more powerful than an individual experience. People listening to each other's stories. I think there's something huge in that. You guys in spiritual communities know this better than me probably, but I think there's something really profound in that I think has not really been well studied in this space. Yeah.
That's exciting.
Yeah.
Thank you.
And that was
Thank
one
you
of
so
Alyssa,
much.
that was one of your questions, right? And you know what? Let me just mention this. Wendy and somebody else mentioned ketamine. So ketamine is another agent that is being lumped in with the psychedelics right now. And the main attraction of it is that it is legal. It is currently being used with psychotherapy in an off-label way, meaning it is not FDA approved for depression. It's not approved for people with cancer or palliative care. So because of that, insurance doesn't cover it, and people need to pay out of pocket. It's also less clear that ketamine has the really profound effect that psilocybin does. It's ketamine is more of a dissociative agent than the kind of the serotonin receptor agonist that psilocybin does. And so it has not really been studied. What I can say from the depression studies is that the depression studies make it look like ketamine has a less deep, much shorter term effect. And so, for example, for people with treatment-resistant depression, it's quite common for them to be getting ketamine every week or every 2 weeks. And so it's not at all clear that I think it's not clear that ketamine is really the same level of agent. And my own hunch is that when psilocybin and MDMA are approved, that ketamine will largely go away. I do think there is something that ketamine does, especially for people who are acutely suicidal. I think there may remain a role for that, but I think it is right now super unclear. And there are definitely people who are offering ketamine for existential distress, and it's because it's what's legally available, honestly. Yeah. Okay. Rose, and then Jeff. Rose.
Thank you for taking my question. I have been suffering from PTSD for basically all my life, and I was very excited that that it became legal in Oregon just now, and I was so looking forward to it. But it's taken me 3 years to find out another health condition that I have, the only other one that I'm very aware of, and that is that I have to keep looking it up every time because I run into well, it's a long one, obstructive hypertrophic cardiomyopathy. And so up front, when I made my first appointment with the specialist in this, once they've discovered it, I asked him about psilocybin, that I was interested in, using psilocybin to work with this other health issue I have. And he said, absolutely not. And because of the stress on my heart. And now, of course, you wouldn't know what the dynamics of what's going on in my heart is, but do you know, and he said he researched it before, because I sent it to him on my chart before I had my appointment with him. But would MDMA be something that has less stress on your heart, or do you know anything about this, I'm looking forward to relief, and before I die, really.
Of course.
It's and I have done everything else except for taking medication for it, because I'm not a drug user, actually. So this is, I'm sure my family and everybody I've told that I want to do this is very shocked. But I believe in this from all my following. I have had a very strong meditation practice. I've done, what is it called? The biofeedback, neurofeedback. I've done everything I can think of, and I still continue religious practice, which I think helps. So anyway, I'm just wondering, use myself as an example.
So you know what, I could connect with you about the details of your personal situation offline, and I'd be happy to do that. And Alyssa can give you my contact. Oops, are you still there?
I am.
Oh, okay. Oh, you moved in my Zoom thing somehow. Okay.
Yeah.
But here's what I can say is, I don't know. I am not sure that from what you're telling me, that your cardiology condition is a deal breaker for either MDMA or psilocybin. So I'd say maybe you and I can talk, and I can get a few more details about what you're dealing with, and I'd be happy to weigh in. And let's see what's possible there. I mean, there isn't that much information about those two conditions, and in particular your hypertrophic cardiomyopathy, but I think there are ways to make some judgments about what the risk would be. And so maybe you and I can connect later.
Oh, that's great.
Good question. Okay.
Thank you so much.
You're welcome. Okay, Jeff.
Yeah. Can you hear me?
Yeah, perfect.
Great to have you here. I'm excited to hear that University of Washington is beginning to break ground on some research in this area. So glad that you were involved in that. I've been excited about what's going on the East Coast, now at UC Berkeley, and other places. So great to have it in the backyard as well. Two things. One, a comment, one, a question. With ketamine, so I've done a number of sessions with ketamine in a clinical session, in a clinical setting. One of the things I have found that it has done for me is because it is a powerful dissociative and you go through an ego dissolution, it has made me more used to what that feels like. And so I'm able to kind of let go and go to that place, even with other things. It is like you said.
Do you mean other psychedelics?
Yes.
Okay.
Yeah, and even in prayer practices as well, trying to really get into that state. But I think what you said about, with psilocybin, someone can just stay in their small self if they want and not kind of go through that ego dissolution. My experience with ketamine suggests that it doesn't kind of allow you to do that. It kind of blows you through that.
Yeah. That may be true. Yes, I could totally imagine.
You kind of can't hang on. So it's kind of interesting that way. The other question I have is about the whole set and setting. So the idea of doing these things intentionally within a container is a frequent term used to kind of get the spaceship pointed in the right direction, so to speak. I'm curious if you could comment on that. Like, you see using this in palliative care and in other areas, what is the importance of the set and setting?
Yeah.
And since this is in a religious context here with Ligare, what, how does the religious container help,
Yeah.
or how will that interplay
Yeah.
with this?
Sure. So I appreciate thank you for sharing your experiences with ketamine. That totally makes sense to me. And I think we just don't know a lot about how ketamine might be used with other psychedelics. So it's very interesting to hear your experiences. So thank you for sharing that.
Yeah, I haven't tried combining them.
I don't think you should try combine.
No,
I don't think you should.
I want to be clear.
I know you're not saying
What
that.
I've done.
I don't think that's actually a good idea for a whole bunch
I
of
don't think it is
reasons, which
either.
I could talk to you offline about. But anyway.
No. I have
Here's
no
what I can
intention
say.
of doing that.
Here's like the set and setting. So imagine, if you were all imagine that you are coming to my study and you come to a room that it's within Harborview Medical Center. It's not in the main hospital, it's in a quiet place, right? But it's the sleep lab, and there's a room that looks like kind of like a Marriott courtyard, and it has a bed and a little table with your stuff on it and a little bathroom inside. And there's some nice lighting, and you have some of your stuff there. And there are people that there because you've met these therapists and you have a relationship with them, and they're holding space for you. And so that's okay, right? It's one kind of experience, and it is an experience that invariably puts a kind of clinical frame on the whole thing, right? Like you just can't get around that. You're walking into you're building at Harborview, and the room, it's better than an acute care hospital room because it doesn't have all that equipment, but it's still kind of room. So that's one kind of setting, one kind of, like, I'll say, physical setting. So imagine another setting. There was a study of psilocybin that was done in the middle of a 5-day Zen retreat at a Zen monastery on, like, up the hill from Lake Lucerne, right? So they had people at this 5-day Zen retreat. They gave them, half of them, psilocybin in the middle of the retreat, and they just kept doing their sitting and walking meditation because that's what they were doing. Like, that's what you do in a Zen retreat. Like, you sit and then you walk and sit and walk, and it's all meditation. And they just did it through the rest of their retreat. And some of the people had to lie down; they couldn't sit anymore. But every time you walk, you go outside, and there's this panoramic view of Lake Lucerne, and there are these trees, and there's this very simple room that you're in, a simple but beautiful room. It's all hardwood, and there are cushions, and there's a couple of little paintings with Buddhist things on them. That's another kind of setting, right? Then there's another place that I've practiced that is a retreat center in the Netherlands. It's about an hour southwest of Amsterdam. There is a large room there with these huge windows that look out onto this forest, and all you see are trees, right? There are no other buildings around. You're in the middle of this beautiful spot. It's this retreat center that clearly gets used for a bunch of different things, but you're there, and the accommodations are super simple, shared bathroom, tiny bedroom, huge, beautiful treatment room. And you're there with a bunch of people, and you're lying on these mats on the floor, and there's this huge group of flowers in the middle of the room, and then there's these huge speakers that are playing this amazing music, and there you are. And so I think because of those different, so imagine those different settings, right? I mean, one of them is in this container of meditation, right? The last one was in this container of nature. And then the first one was in this container of, a Marriott courtyard. And those things can't help but provoke different associations from you that are all kind of unconscious and unintentional, right? Because you have experiences in nature, you have experiences looking over lakes, you have experiences in hospitals, and they just come back to you in different ways. And so I think that's what I would say about the set and setting. I mean, I don't think I think they're one powerful kind of aspect of the experience that happened. They may not be completely the determining factor. Like, we do lots of deep psychological work with people in our Marriott Courtyard room, but honestly, I feel like we have to do a little bit of extra work to get them past that into the territory that I think is really valuable. And I think if we were in a rustic retreat center, it would be a little easier, right? And if you wanted people to do work on their spiritual formation, if you had them in a container where there was a little bit of ritual and a little bit of context and some people who were holding that kind of particular space, I think it would be easier, and you might do more with with whatever kind of psychedelic experience that you have. So that's what I would say about that. And I think that's why it's important to realize that it's not just about taking this pill, and it's not just about this thing that you can do yourself at home. I've actually, I've been a mentor in the CIIS, the California Institute of Integral Studies, practitioner training program. And there I've met a number of students who didn't have prior experiences, and they tried a DIY thing in their own bedrooms. And most of them don't have great experiences. They don't have deep experiences. You actually need a guide to help point you and to nudge you at different points during your experience. And it really helps to be in a place that evokes associations that that actually point you in the direction of what you're trying to work on. So that's what I just want to say about set and setting.
Wow.
Yeah.
Tony, I'm wondering, it seems like a lot of the research you're doing currently is really starting to chart new pathways for this work in the medical field, as well as kind of starting to breach, as you were saying, like doing these studies at a retreat center. And I think that just kind of takes this into completely new territory. And that, with also the research in having the nurses and doctors and use this medication and use these substances. And you had mentioned how impactful that was for you in the work you do with your patients, that the communication you have and connection you have with patients. And so I guess what I'm curious about is, where do you see some of this going, like the group work, kind of bridging spirituality and research, and finding the right set and settings.
Yeah.
Yeah.
So, you know what I think in the near future, my guess is, this is my hunch, is that there's going to be a whole medical track of psychedelics used for mental health conditions with, diagnosis. They're going to be done in more clinical settings. I think they are going to be done with clinicians who have the right kind of clinical experience. Because honestly, if you do have somebody who has severe PTSD or severe depression, you actually want a guide who has some real psychological experience, right? And then I think there's going to be this other direction that has been going on underground for a long time, and is also going to be starting in Oregon, which is psychedelics for what, Bob Jesse called the betterment of well people, right? Psychedelics for personal exploration, psychedelics for deepening of one's emotional life or one's spiritual life. And I think to your group's point, psychedelics for spiritual formation, for different kinds of spiritual formation, right? And so I think the opportunities for that are going to be different than the medical opportunities, but I think there are going to be I think there are going to be some research studies that are happening. And I am hoping that this is done in Oregon in a way where we can capture some of that experience in a way that really helps people understand what's possible and helps identify what helps make those experiences really work for people and really valuable for people. Does that, so I think, I see in the short term these two big directions, and I'm hoping that, the medical direction can provide some leverage to help the other direction, make the other direction possible. I think the more data that we have, medical data, that this is really safe, the more likely legislators are to say, yeah, we can decriminalize this or legalize this in limited, in specific ways. And I'm hoping that with input from a variety of professionals, including spiritual professionals, that the allowances for legal use can include maybe leadership development, maybe spiritual formation, maybe, personal exploration, right? Like, I'm hoping that can be possible. And I think the important thing is going to be for us as interested people to start to define those kinds of ways in responsible ways, so that people can be accountable for these medicines, because they are really powerful medicines. I mean, they are, I think, generally safe, but they are really powerful, and they can be abused, right? And so I think we are, as a society, are going to have to come up with a way to talk about that, to put some guidelines on that, talk about what is really important and what is really needed. And then, to Beverly's point, I actually think some new faith language might be really great, right? Like, what is the language that you use to talk about your own spiritual experience when it kind of blows through what you've been doing for 20 years as a Zen practitioner, or for 20 years as a Christian, right? Like, maybe if you're Thomas Merton, you don't need that new language, right? He was creating it. And, I have a deep respect for him. Like, he probably is one of those people, who probably didn't need psychedelics. And yeah, for the rest of us, I think this whole sense of where this spirituality takes us, which I would hope, here's my own private hope, is that it takes us from this little, collection of different communities into one bigger spiritual community that isn't all the same, right? But that people can see that all these spiritual communities are different ways to get to, I think, what in many ways is a shared kind of aspiration for what it means to be a human, right? And that you can play that in many different tunes, right? With many different particular kinds of things, right? Which all, I think, are beautiful and deserve their own attention and their own community, but that are shared, that have many shared, deep values.
Thank you. It kind of brings up another question too, is with cannabis legalization that happened so everywhere. And you were talking earlier about, there is that tendency for somebody when something's easily accessible and you don't have the right preparation, integration, support, that it just becomes a recreational thing or something kind of more escapism. And I've connected with a community that's out of Colorado that's done guided cannabis circles, which kind of has taken back and really that these are powerful medicine. Right. And it was just this thought of, we've had conversations about these stigmas, and I think that's one that's really been stigmatized, and that we forget, oh, this is a very powerful medication that has been being used and kind of coming into this.
I think cannabis is a cautionary tale for us. Cannabis was legalized, and in a way that very little research has been done on cannabis, that there hasn't been any kind of community of practice that has grown up around cannabis. I have definitely talked to a handful of, maybe not a handful, but a few different psychotherapists who have used cannabis in a very specific way with clients, and they have found it to be really a powerful adjunct to the work that those clients are doing. And I actually feel like there is some wisdom out there that has really never been collected, and we don't really know in a very clear way. And so because of the way that cannabis got developed and the rush of these huge companies in to monopolize the cannabis market and to market it in a way that just sold a lot of cannabis, right, without regard to what is the real use of cannabis, right? Like, I think we've kind of missed something, is my own feeling about this. And maybe the psychedelic work we are doing now can help us loop back and see what the real use might really be. And I think we have to be open to that. And, it turns out, like, for example, for me as a researcher to do research on cannabis, it's like super hard. There's nobody who wants to fund cannabis research. No one, not the government. There's no companies, there's no foundations, there's nothing. Two, the only place you can legally get DEA Schedule I approved cannabis is from one source in Missouri. There's some little place that creates that grows cannabis that you can use in a study, a DEA-1 study, but actually what the word on the street is that it's lower quality than all the cannabis that I can buy like at my downtown store in Seattle, like half a mile from where I live. And there's really been no incentive and no structure that's created to help foster what responsible and valuable use of cannabis would be. So I feel like actually we don't know.
There's a organization out of Boulder, Colorado, Medicinal Mindfulness, and they lead conscious cannabis circles, which are contain that, and it's just really transformative.
So groups like that are starting. The groups like that are starting, and I know there are a couple of them out there, but they're I would say they're small. They're fledgling right now.
I hadn't heard of it, until very recently, and so, But like you said, a cautionary tale of the ways, and I think we have kind of where it was that recreational, and it was money again, and then we kind of, as it's in the research, the pharmaceutical kind of making costs and difficult for some of the other.
Well, and of course, if you look at this from the perspective of the plant medicine people, they would say that, that was not done in a way that respected the spirit of that plant medicine, right? And so now we are reaping the consequences. It is considered a street drug for practical purposes. It's being abused and used a lot. For what purpose? That we don't really know what the real purpose is, right? So anyway, and Stacy, it's great that that the UW is doing a little bit of cannabis research. I will say that the research that is being done at the U, it is not intervention research where people are being given cannabis it's mostly like patterns of use in the real world and stuff like that. I might be wrong, but I don't know. I actually talked to the DEA people about other cannabis researchers at the U, and there's nobody who's actually doing intervention work with cannabis, and it's very rare in the whole country.
One of the questions that came up in the chat was about accessibility and about availability as this moves forward. And one of my hopes, really, with my work as a priest and trying to have this conversation in the church, is that religious communities like the Episcopal Church or the Catholic Church could be part of our ministry, could be making this available to people, because we have property and retreat centers and people and I don't know exactly what that'll look like, but I do hope that one of the ways that religious communities can help with this is by making it available to people that might not otherwise have.
I think that's an amazing idea, Hunt, and I think it's really interesting that in many ways religious communities have some infrastructure that you need to have an intentional community that is structured around spiritual formation and that might responsibly use a psychedelic medication as part of their mission, right? And I think figuring that out, I think, is a really interesting question. I also think that one of the ways that they might make that available, especially for people who don't have severe mental illness, is that it might be a whole different, more peer-led kind of group or a peer-led kind of experience that might be perfectly adequate for many people and might be great for many people because it would be outside the medical system. And so I think there is an important thing there to explore as these medicines are tested and go into practical use. And so I think, one of the things that I think we are looking at now is a revision of the mental health care system, right? Which has, made everything a visit to a clinic. And in fact, what many people need for wellness is not more clinic visits. They need a community. They need people to lean on. They need elders to provide advice, right? They need a series, they need a moral framework, right? And I feel like our society right now is just struggling with all those things. And I think there could be a place for religious communities to really step in a big way.
Yeah, And I think I don't know what it could look like, but I really appreciated you talking about the spirit of the plants. And I think one of the things that you've talked about, this really embodied experience that can come along with these medicines and starting to connect not only with each other, healing our own personal wounds, but connecting with the world and the planet. And we're in such a crisis collectively, evolutionary.
Yes.
And that, yeah, I think that's, yeah, I mean, there's something to the spirit of this medicine that's really coming to life right now and
Yes.
working with and through us. And it's incredible to see. And it's kind of like just being pulled along with this wave of it.
Yes. And I think that language of the spirit of the plants actually needs to be developed kind of in parallel with the medical language, so that there is kind of an alternative language for using these plant medicines and for talking about these experiences that is not just the medical frame. Like, I think, as I said, the medical frame has some real benefits, right? But I think it can't be the only frame. And so I think those of us who have a foot in both worlds, or those of you who know the other world much better, I think you should not be feeling that you have to speak in medical language all the time, because I think that will be very constraining. And I think there is an important mission to be served by actually creating this new and updated language. And I think it might be that it's many of the ideas and feelings and concepts that you all in spiritual communities have been honing for millennia, right? And maybe the issue is how do we update that to accommodate the psychedelic experience as it is going to appear in our culture now, right? So I think that would be a huge service in the psychedelic ecosystem.
I'm going to see if there's any questions. We got a little bit smaller group now, to see if there's any questions that haven't. Feel free to raise your hand if there's something that sort of come up for you all. So happy to see this group. Any other questions? Alyssa just puts in some research or some information about
some resources. Yeah,
the resources and his email address, that's very generous offer from him.
Yes, and maybe Rose, you can just actually reach out to me by email. You don't need to get it from Alyssa. Okay. Yeah. Yes, Wendy.
I just wanted to say I did hear you at Horizons Northwest too, so thank you. And I served as a hospital chaplain during the pandemic. I have left the hospital since then, but I just want to thank you for doing the project you're doing. That was very much on my mind. I mean, I definitely did things around staff care during that, but really knowing the need for more intensive. And I was trying to think of how I could do retreats for the staff. And I've just finished an eco-spirituality year-long program too, and just the role of nature. So the whole psychedelic layer too, just really, really excites me. So I just wanted to thank you for doing that important work. And I just hope it spreads and is available to more and more medical staff that have experienced all that. So thanks.
Yeah. Thank you, Wendy. Yeah. We've had a lot of interest. I mean, the main kind of barrier for people is that we have been selecting people with a high symptom burden. And so there are a number of people that we have turned away who have not had as high symptom burdens. But there's clearly something quite remarkable for people as they go into this.
Yeah, it'll be, I hope that we can find a way to reach that community in Oregon eventually when things are more set up, so that those with, less high needs can access it.
Yes, I think so. Yes. Well, and I think there are a number of people who even just got the idea from this study that have pursued this on their own in different ways. So who knows? Yeah. But I'm hoping there will be legal means, because I do think that's important. Jeff.
Now, are you getting any inquiries or interest from state legislators on all this, having conversations with them?
So I have talked to Jesse Solomon, who is the legislator who is bringing the Measure 109 lookalike bill in Washington State, and they are going to bring something. They are really going to try and bring something to the legislature in 2023. which would be a legislative bill, not a popular initiative, so it wouldn't require a popular vote. And the measure that they are working on is very similar to Measure 109 in Oregon. Yeah, so I have been talking to them, and I have been at a couple of hearings. And I think there is a significant level of interest, and there is a significant level of like caution, right? Like, because they're, legislators who don't do much in healthcare, and they're worried about, what is there a safety thing going on here, right? Because it's an untested thing.
Thank you.
Yeah.
Tony, one of the things that in your talk from in Portland that several things stuck with me on that, but one was you talking about the early years of the AIDS epidemic and eventually what happened and really shifted the whole narrative in a way, or the whole work was activism from the communities affected by most affected. And so I'm wondering, and you've kind of touched on this a little bit by saying we should get involved, but I'm wondering what religious professionals, and not just professionals, but religious people, spiritual people, can do to move this forward.
That's a great question. So, at Horizons, I was making a parallel between what happens in the AIDS epidemic. So I'm a gay man who was in medical school when AIDS was first recognized. And, what I saw there was a combination of forces that pushed for social change. It was not just medical research. And in fact, there was no money for medical research allocated by the NIH until AIDS activists got out and made a fuss that this was really important. And they made a fuss in a bunch of different ways. There were people in ACT UP who did things that were designed for cameras to see and designed to be covered by the news. They locked them, they chained themselves to the FDA. They did die-ins in front of government buildings, and they were widely, decried. And at the time I thought, wow, these people are really crazy. But actually, it turned out that was a way of getting public attention at the time. And they combined that with other people who worked behind the scenes and worked with the policy people and worked with the legislators and said, if you're going to do something, this is what you should do. And what they did was they got money from the NIH to invest in major research. That directly led to the antiretrovirals that we have now that are lengthening people's lives. And they changed the way clinical trials were done so that there were patient advocates on all the advisory boards, right? And that was an innovation from the era of AIDS. And I think what I mean there is to say that we should think of the introduction of psychedelics into our culture now as a major kind of social change. And there are many ways that all of us can participate in moving that forward. And just showing up for different things is really important, because if one of you were to show up at, for example, a legislative hearing where any one of you, I'm just looking at the windows here, you're a different kind of person than some of the psychonauts who show up, who do look like they've been doing a lot of psychedelics for a really long time, right? Like having you show up as part of the reason and to say, actually, I think this is an important thing for spiritual development. And I think there is potential that this could create a whole different kind of way that our culture holds spirituality, right? That I think that could lead to a better society, right? I think that would be super powerful for some of these legislators, right? Because I think they are, the people they hear from now, for example, are like the psychonauts, right? I don't know that they're hearing from a lot of everybody else. They are starting to, but I think speaking up as a member of the public who thinks there is something in it for them, I think that's really important. And I think there's a place for all of us in this. And so I think the religious professionals and religious communities, for them to speak up and say, we think this is really important, I think that would raise a lot of eyebrows in policymaking circles and legislative circles, that this is not just the lunatic fringe of psychonauts and then a few scientists who want to do treatment-resistant depression, right?
That's really good, Tom. Thank you.
Yeah.
I loved how you said there's a place in this for all of us. And I had just written down to find your place in this. And I was just really struck tonight by, sometimes I feel like, oh, there's these two different trajectories, but it's just really this just big bubble that's getting created, this big container that's kind of holding all of this. And there's all these different spots and places and ways that it's coming together, and we don't even know yet.
Yeah.
But speaking up, and I think the way this is how stigma is getting broken.
That's right. I think that is exactly right. I mean, one of the reasons I wrote the article in the Journal of Palliative Medicine was exactly about that. It was about, because it's the first article by a doctor about their personal experience in the medical literature. And I did that very specifically because I felt like that was a very important public statement to be out in the world. I mean, I published it at a time when none of the big researchers talked about their own psychedelic experiences, right? And, as a gay man, I can tell you that what I learned from the gay activists was, until you all come out, the culture will not change. And you know what? They were right. And until we all talk about what is in it for us to have psychedelics available in a responsible way, right? It won't happen in the way I think your group is interested in having it happen, right?
Yeah. I heard Caroline Peacock at Emory. She's a chaplain and running the organization called Transforming Chaplaincy, their psychedelic initiative. And Emory just started a spirituality and psychedelics institute. So Emory's emerging in a spiritual way. But Caroline Peacock, I heard her say, and I think this is true, that it's a justice issue. If we have something we know can help people, and this is about, but for people with depression, PTSD, addiction, we know we have something. And now we have to do something about it. Now we have to make it available, because otherwise people are suffering unnecessarily.
Yeah.
And people are not getting the spiritual growth and development they could potentially improve, but in a very medical, just a basic mental health model. We have the medicine, we have not doing it now.
I know. I mean, I hear you about the justice issue. And I think the question that I have here as a social change, in my life as a social change maker, is what is the leverage point for the big public going to be, and how do we get started with that? And I am sad to say that justice has not been a powerful force for medical care. I think we have failed on the medical care access in general for people, and I am not sure that justice has been the lever that's pushing people right now. But I do think mental health now is going to be a new layer of this, and I think mental health is affecting huge groups in this population in a way that is making everybody go, "Whoa, is this really the way we want our society to be?" So I think maybe there's a new opportunity there. So yeah. Wendy, maybe there's a new opportunity there.
Well, I was just going to say on this issue of justice that the Graduate Theological Union did a series on religion and psychedelics. The one unit on chaplains, Kamal Abu Shamse, said the work of a psychedelic chaplain is rooted in justice, of being there for people who are suffering while going through a spiritual experience. And I just thought that captured that point so well. I just love that quote.
Yeah, that is a really interesting frame on that. So thank you for that, Wendy. I think that's a really interesting frame. Sorry, I'm hearing an echo with somebody. So, but anyway, thank you for that with somebody.
Hi, I'm waving. I'm in the background with Greg. I'm Ruth Ann.
Yes.
You just said, I'm a newbie to all of this, so this has been just very enlightening and refreshing, and I really enjoyed it. I was listening, there's a podcast called The Christian Psychedelic and podcast, and it's a guy who did psychedelics, and he does a whole podcast interviewing a number of people who actually were in the Johns Hopkins trial that were spiritual people and different things. But going to what you said about maybe what can be a fulcrum in turning people's opinions. One of them was on a PTSD, a military veteran and their family. And it was a wife and husband who, I can't remember their names now, but they really shared the struggle he went through over many years and losing almost everything they had.
Yes.
And struggling so hard for him to be healthy and healthy with their kids. And it was just a heart-wrenching story.
Yeah.
And so finally at one point he did an ayahuasca ceremony, and then eventually got into, I think, some MDMA therapy work. And it was like night and day for him in terms of his mental health. And I thought, wow, I think if, some of the perceptions, if even our military and veterans and some of the, people on different sides of the political aisle can see that kind of health, kind of goes back to, if we can know that there's something that can work.
Yes.
That would be my hope, I guess, is that could be one avenue. Because, for me, it's going to be the whole, how do I delve deeper into my own spirituality? But I also see that there's this whole other, I have a niece who's a hospice chaplain, and, I can see just so many aspects of how this could work for people in so many life-changing ways. And so anyway, that's my
I think you're onto something there. The people at the Multidisciplinary Association for Psychedelics that are bringing MDMA to market. I mean, one of the reasons they started with MDMA was because they knew there was a huge potential use with veterans, and they knew that then it could not be used as easily in the culture wars. And so that, in fact, was a tactical decision that they made to focus on MDMA, and MDMA is probably going to be the first one that is approved by the FDA for that reason. And the hope is that it will avoid the whole culture war issue. We'll see. I hope that is true. But it's the culture wars have their own purpose, which is, not related to what we are talking about here.
Very true.
Yeah.
Well, we are at 6:24, and if somebody has one last pressing question, we can go ahead and take that. But I want to respect everyone's time. We've been working out the time frame for this new developing regional meeting. So this we did a little bit longer just because we had Tony Bach joining us. Thank you so much for everyone being here and staying for the whole thing. But I want to let you know where some people have jumped off. We went a little bit longer, and we're kind of feeling this out. I just shared your resources again in the chat box.
Perfect.
Oh.
Perfect. And thank you. And thank you for these great questions and great discussion. It's been wonderful to be here, and I'm excited to see you guys as allies in this very interesting process of social change that we are in.